the clavicle is classified as which type of bone? A. Long bone. B. Short bone. C. Flat bone. D. Irregular bone. Answer: A. Long bone. Explanation: the clavicle is a long bone, despite its horizontal, somewhat flattened shape. It is the only bone that connects the upper limb to the trunk, functioning as a strut to keep the shoulder in position. Which of the following joints is formed by the medial end of the clavicle? A. Acromioclavicular joint. B. Sternoclavicular joint. C. Glenohumeral joint. D. Scapulothoracic joint. Answer: B. Sternoclavicular joint. Explanation: the medial end of the clavicle articulates with the manubrium of the sternum to form the sternoclavicular (SC) joint. This is the only bony articulation between the upper limb and the axial skeleton. What is the primary function of the clavicle? A. Protection of the thoracic organs. B. Transmitting force from the upper limb to the axial skeleton. C. Providing a surface for muscle attachment. D. Supporting the vertebral column. Answer: B. Transmitting force from the upper limb to the axial skeleton. Explanation: the clavicle functions as a strut to hold the arm away from the body, transmitting mechanical force from the upper limb to the axial skeleton. This helps in the mobility and stability of the shoulder. Which of the following is located at the lateral end of the clavicle? A. Conoid tubercle. B. Acromial facet. C. Subclavian groove. D. Sternoclavicular facet. Answer: B. Acromial facet. Explanation: the acromial facet is located on the lateral, distal, end of the clavicle. It articulates with the acromion process of the scapula to form the acromioclavicular (AC) joint. The conoid tubercle on the clavicle serves as the attachment point for which ligament? A. Costoclavicular ligament. B. Coricoclavicular ligament. C. Acromioclavicular ligament. D. Sternoclavicular ligament. Answer: B. Coricoclavicular ligament. Explanation: the conoid tubercle is located on the inferior surface of the lateral end of the clavicle. It serves as the attachment point for the conoid ligament, part of the coricoclavicular ligament, which connects the clavicle to the coracoid process of the scapula. Which of the following structures is located on the inferior surface of the clavicle? A. Subclavian groove. B. Acromial facet. C. Sternal facet. D. Costal cartilage. Answer: A. Subclavian groove. Explanation: the subclavian groove, found on the inferior surface of the clavicle, provides a passage for the subclavian artery and vein. It also serves as the attachment site for the subclavius muscle. Which of the following muscles originates from the inferior surface of the clavicle? A. Pectoralis major. B. Subclavius. C. Trapezius. D. Sternocleidomastoid. Answer: B. Subclavius. Explanation: the subclavius muscle originates from the inferior surface of the clavicle. It helps stabilize the clavicle and depresses the shoulder. What is the most common site of fracture in the clavicle? A. Medial third. B. Lateral third. C. Shaft. D. Acromial end. Answer: A. Medial third. Explanation: the medial third of the clavicle is the most common site of fracture, particularly in children. This is due to the relative weakness of the bone in this area, which is often subjected to forces during trauma or falls. The clavicle articulates with which of the following bones at its lateral end? A. Scapula. B. Humerus. C. Sternum. D. Rib. Answer: A. Scapula. Explanation: at its lateral end, the clavicle articulates with the acromion of the scapula to form the acromioclavicular (AC) joint. This joint is important for the movement of the shoulder. Which of the following ligaments attaches to the clavicle? A. Coracoacromial ligament. B. Acromioclavicular ligament. C. Pectoral ligament. D. Iliolumbar ligament. Answer: B. Acromioclavicular ligament. Explanation: the acromioclavicular ligament connects the acromion of the scapula to the clavicle, stabilizing the acromioclavicular joint. Other ligaments, such as the coricoclavicular ligament, also contribute to the stability of the clavicle. The clavicle is most likely to be fractured during which type of injury? A. Direct blow to the shoulder. B. Flexion of the elbow. C. Extension of the knee. D. Fracture of the femur. Answer: A. Direct blow to the shoulder. Explanation: a direct blow to the shoulder, such as from a fall onto an outstretched arm or a direct impact to the chest, is a common cause of clavicle fractures. The clavicle is relatively thin and transmits forces between the upper limb and the axial skeleton. Which of the following is the correct order of structures from medial to lateral on the clavicle? A. Sternal facet, shaft, acromial facet. B. Shaft, acromial facet, sternal facet. C. Acromial facet, shaft, sternal facet. D. Acromial facet, sternal facet, shaft. Answer: A. Sternal facet, shaft, acromial facet. Explanation: from medial to lateral, the clavicle consists of the sternal facet, where it articulates with the sternum, the shaft, and the acromial facet, where it articulates with the acromion of the scapula. The clavicle helps in which of the following movements? A. Knee extension. B. Shoulder abduction. C. Elbow flexion. D. Ankle dorsiflexion. Answer: B. Shoulder abduction. Explanation: the clavicle acts as a stabilizing strut for the shoulder, helping to position the scapula so that the shoulder joint can move effectively, particularly during movements like shoulder abduction. What type of joint is the sternoclavicular (SC) joint? A. Ball and socket joint. B. Saddle joint. C. Pivot joint. D. Hinge joint. Answer: B. Saddle joint. Explanation: the sternoclavicular (SC) joint is a saddle-type synovial joint that allows for movement in multiple directions, including elevation, depression, protraction, retraction, and slight rotation. The clavicle provides attachment for which of the following muscles? A. Trapezius. B. Latissimus dorsi. C. Deltoid. D. Subclavius. Answer: D. Subclavius. Explanation: the subclavius muscle originates from the inferior surface of the clavicle and attaches to the first rib. It stabilizes the clavicle and assists in shoulder movement. Which part of the clavicle is most likely to be involved in a clavicle fracture? A. Lateral third. B. Medial third. C. Shaft. D. Acromial end. Answer: A. Lateral third. Explanation: the lateral third of the clavicle is more commonly fractured, especially in the case of trauma, as it is the most vulnerable to mechanical stress during impacts. Which of the following conditions is commonly associated with an acromioclavicular joint injury? A. Shoulder dislocation. B. Shoulder separation. C. Rotator cuff tear. D. Biceps tendon rupture. Answer: B. Shoulder separation. Explanation: a shoulder separation refers to the dislocation of the acromioclavicular (AC) joint, which can occur when there is trauma to the clavicle or scapula, often resulting in a fall onto the shoulder. Which of the following is not a function of the clavicle? A. Connecting the arm to the body. B. Protecting vital chest structures. C. Providing a point of attachment for muscles. D. Allowing for pronation of the forearm. Answer: D. Allowing for pronation of the forearm. Explanation: the clavicle does not participate in the movement of the forearm. It primarily serves as a structural support, providing attachment points for muscles and transmitting force between the upper limb and the trunk. The clavicle articulates with the sternum at which specific part? A. Acromial end. B. Sternal end. C. Shaft. D. Conoid tubercle. Answer: B. Sternal end. Explanation: the sternal end of the clavicle articulates with the manubrium of the sternum at the sternoclavicular joint, forming the primary bony connection between the upper limb and the axial skeleton. Which of the following ligaments is located between the clavicle and the first rib? A. Coricoclavicular ligament. B. Costoclavicular ligament. C. Sternoclavicular ligament. D. Acromioclavicular ligament. Answer: B. Costoclavicular ligament. Explanation: the costoclavicular ligament connects the clavicle to the first rib and helps stabilize the sternoclavicular joint. It plays a key role in maintaining the position of the clavicle relative to the rib cage.